Hi everyone, this is Dr. Ashwani Kumar, and I have a wonderful news. Well, we have Dr. Manav Shah with us, who recently scored the rank of 13 in INICET November 2023. And on the eve of Diwali, we got news. First of all, many congratulations, Dr. Manav, for securing this wonderful rank. I formally want you to introduce yourself and tell where you did your graduation from and tell a little about your journey.
Okay, thank you very much, sir. It's been really a pleasure talking to you. Happy Diwali to you too. I am
Okay.
Dr. Manav Shah, student of KM Hospital, Mumbai, and I have secured an All India rank of 13 in INICET November, and really happy to be here. It's been a great journey. Preparing through the phase was really a pleasure, and really happy to be in this position right now.
Okay, Dr. Manav, well, looking at your rank, when I said ki, well, people say that 13 is an unlucky number, well, how can when you scored rank 13 in CET? So many congratulations once again. Manav, थोड़ा सा आपकी journey में चलते हैं. Let's get to know कि how it all happened. Like जब होता है ना, when you get success, then people treat you as celebrity and they ask you questions like what was your first reaction? I would want to know then on the eve of Diwali when you checked your result and you got this rank of 13. I would say it would not be a surprise for you because you already scored a very good rank last year as well. But yeah, I still wanted to know what was your first reaction. Mute. Yeah, mute. Manav. Yeah.
Hello.
Yeah.
So definitely, really happy. Definitely, not very happy to see the rank. I was expecting a rank of around 20, but
Okay.
it was definitely not a bad number, not a really bad number for me. Really happy to be getting this rank.
Yeah. Well, people who scored already the rank of like 14 and NEET rank of 23, they can expect a rank of 30, in the exams. So it was nothing new for you, I would say. Manav, tell us a little about how it all started. I mean, did you start in your during your graduation only, or did you start in an internship or after internship? We need to know a little about your journey.
So, like, I wouldn't say my preparation started from internship. Like, it's a very big course, and every year reading the standard books and building upon my time. Like, after finally over my internship began, more on the MCQ part, and then started revising the subjects one. So having a strong basics definitely helped me. I used to participate in quiz, and helped had a good strong foundation to go with, and definitely that helped in my INICT preparation from the MCQ point of view as well.
Okay.
So
Uh,
again, the right from the basics is very that I would like if you're strong, solving part will not be a problem. Focusing more on MCQ topics or using shortcuts in the long run. So MBBS, I feel it should be taken step by step, and at the same time, like important things like GTs and test and discussions on a regular basis once your internship begins, and once all the subjects have been read once at least.
okay. Well, Manav, the batch who suffered a lot in that COVID time, काफी classes नहीं हो पाई थी and everything. So, how did you manage the classes? In the regular classes, was it online? कैसे रहा था वो journey आपका वो time?
So it was all going very, we didn't know what is going to happen, and there was a lot of uncertainty around us. So the college had stopped everything. So I just so there was classes initially, then it was switched on to the online mode. We weren't used to the online mode earlier, so it was difficult at first. Eventually, and it indeed a good thing
Yeah.
in some way and bad in other way. But yeah,
Yeah.
the overall journey was fantastic, I would say.
Okay. And what all classes you attended with us in DBMCI?
I attended most of the lectures, but especially like I attended all the lectures of NAT, radio and medicine from Thamim sir, radio from Rajat sir, and NAT from the great Ashwani Kumar sir himself.
Okay. Thank you. So I hope your experience was good. Like we all treated you well in the subject.
It was fantastic. It was fantastic. First year anatomy, I was scared about anatomy, and I
Everyone is.
wasn't clear with all the concepts, I would say, because it was very difficult to imagine stuff. So after I attended your lectures in third year, it was so simple and so good that anatomy became a cakewalk for me later on. Definitely. So it helped me, in radio as well as surgery, OBGY, all of the subjects. Anatomy was something that really along the way.
Okay, thank you so much. Well, I don't have to take the review of radiology and medicine class because I know how these faculties are. Like, they're wonderful teacher. Manav, I also wanted to know. You said you attended the classes in third year, like you attended a NAT in third year. But from third year, then giving the exam, that's almost a 2 year in between. Then how did you manage? Like, I wanted to know that some people who are the foundation students who attend their class little early, then how to kind of here. Once you're done with that, and you still have 2 years to give the. How are you gonna go about it? Like, how do you revise those subjects?
Yes, so while there was like while there were lectures going on, I used to make the notes properly and in a way that I understand. Whenever there is a diagram, if I understand the way, I will draw it that way, and I used to revise it straight away after. That is the revision is the first step. Then I used to revise it in the weekend or the next weekend, so that I'm getting it revised once again in after one, and then revise on a integrate week. After my ENT was done, I used to revise the ENT part of anat. Surgery, I would anatomy of the abdomen and anatomy of lower limbs while I was reading varicose and all the veins anatomy. So integration really helped me integrated. Example, inguinal hernia surgery. Everyone, you have to know and understand the anatomy of inguinal canal, the femoral canal, everything. So I used to integrate that stuff as well. Like, I saw in what I saw in was the questions was not really conceptual, pure anatomy questions. It was clinical and it was what is regularly seen questions. So it really helped me to like read the topic from a subject and then correlate with the anatomical concept.
Yeah. So it's like for I would say it's like clinical anatomy. All the relations and
Yes.
everything is not important. You need to understand that what surgical relations are important. Like that's how you need to approach this. And I agree. Well, in people who start a little later, like people will start in the internship or after internship. What your suggestion is because you've already scored rank consistently in last three exams, I would say. So what that if like point of if they so what
Yes.
do you say? What your preparation should be? How should you go about these subjects?
If the person hasn't even prepared for the exam, the best thing I would is TND and courses of like Bhatia. This thing, because TNDs will cover the important topics. That is the most important thing. From the
Yeah.
PYQs, the topics are asked like frequently the same topics are again and
Yeah.
again.
Yeah.
So it advice and the question is not important. The question along with the whole topic is properly, which happens in a integrated way in TNDs, really help you. All the topics are covered and you don't. So most of the out of 10, at least 8 to 9 you will be able to answer from those basic questions. That is how it will really help in a long way. Like if you have only 3 to 4 months, that is the best way to go forward for all the subjects.
Okay. Dr. Mana, what do you believe is the main difference prepare for the NI? Though nowadays it's not much of a difference with the way the questions are being asked, but looking at the time frame because we have like almost 3 months for the NEET exam and the next INI would be in May. So is there any particular topic or subjects I would say that you need to pay more attention for the INI and the NEET exam? Like what your assessment? You scored wonderful
Yeah.
rank in both the examinations. So but
So what I had on INICET was focused more on the preclinical. Like there was a lot of patho, pharmac, physio, and micro. Like pharmac almost had questions in this year's INICET. So there was a lot of weightage of first and second year subjects. Along with that, the variety of questions was very different. There were a lot of reason assertion, lot of image based questions, a lot of multiple correct ABC, ABD, such type of questions, which is not the case in NEET. NEET
yeah,
has a lot of straightforward questions. They will
yeah.
give you a stem which will give you the answer in a way. They will give you
Okay.
subtle hints. So NEET is easier on the way in that way, but NEET has a lot of topics to be covered.
Mm,
INICET has a lot of repeated topic questions. Like
mm,
they don't repeat the question, but the topics repeated every year. Like the cranial nerves questions, spinal cord one question, the fornix there is one question. So
yeah.
there are a lot of repeated topics every year. Of differentiation of topics, lot of variety of topics that are asked. Questions are really straightforward. say the past year's topics are the past year in NEET. We had 80 repeats in the last year in that May NEET. So yes, PQs are very very important as far as NEET is concerned. And I see the important thing is the PQs, that is the previous year topics.
Yeah. But nowadays they don't test you on the topics; they test you on the way they can ask the questions. They formulating different kind of options, people reasoning and assertions. The same questions are being asked, but that the more tricky by like things to the options. Yeah?
Yes, definitely.
Okay. Dr. Manav, how did you test yourself? I mean, once you're prepared for the subject, then you need exam. So, like, were you more of a subject-wise test person, or were you like more like a GT person? And when do you give those tests?
More like a GT person, to be honest. So I started giving GTs right from like final year. And I used to like just give the GT for learning on topic, like it was not just for getting a rank or for a score. So my perception was like, if I am solving a question, I'm actively thinking about it. Even if I go wrong in that question, I'm going to learn something out of it when I review the questions. So it was one of the things. But yes, subject wise test was also important. So when I was in internship and I was preparing subject by subject, so what I used to do, I used to read a subject, and then after 1 week I used to give a subject wise test. So I am testing my memory here. It is very easy to give a subject wise test on the next day once you are done with the subject. So I used to give it 1 week after the subject was over, and I had already I'd started another topic. So I was testing myself constantly. And then once I was done with like I used to give two GTs like
Okay.
on a Sunday, and then the whole Monday I used to give for review. The review part
Okay.
was very important. So
Yes, it
every
is.
GT has 200 questions, but I used to take as 200 topics that I would review the whole topic in detail. So all the other four options are also ruled out properly, and I have known the whole concept by the end of the question when I review it. So that was my approach towards GTs, which is, I guess, one of the most important things one should focus on.
Okay. Okay. Um, you did your internship from Mumbai only, is it?
Yes, sir.
You were completed just your time for the preparation only.
Yes, sir.
Okay, so because you scored a wonderful rank last time also, so and you're relatively, I would not say free, but you're relatively free, I would say, because you're done with the internship. So what was your like how was your last 3 months, I would say, because people who are appearing the NEET exam, they have 3 months exactly. So I wanted to get into your head that how your 3 months were. Just go back into the 3 months and tell us, ki, okay,
So
how did you went about it?
yes, so I just kind of focused on the TNDs more
Okay,
of, because I used to give a lot of tests and discussions. Because as I
okay,
said, I the more important topics were covered, and I used to it was solving as well as testing yourself. So that was really helpful. And the other thing was PYQs and GTs. That was the only thing I focused on. I did not actually go for something new or something, tried something else. What I had done in the past 5 years or 4 years or whatever review I had done in the internship, I just stuck to that, and I went ahead.
okay. And Dr. Manav, did you give vibe also? I mean, did you attend vibe as well?
Yes, I had attended vibe in internship, and I just
Okay.
revised the notes in the last 3 months.
So was it Vibe helpful? Because like for the subject like ANAT, I would say ANAT, and for many other subjects, Vibe comes like a quick recap of the entire thing, because our subjects are more like images only. So
Yes,
how
yes,
was
yes.
the Vibe? How was the
So
experience in the Vibe?
definitely, vibe was very good, especially for subject like ANAT, lot of patho and
Yeah.
micro, all the bacteria, and it was really, really good. And the best about it is you cover the whole topic at once. It is the ANAT, and you just label it. The whole topic is covered along with it, so that was really helpful in an integrated way. Like the need has a lot of questions where they give you the stem, then they give you the pathology, then they ask about the disease, about the diagnosis, or about the true and false about the disease. So the whole topic was cleared at once, and it was really helpful in attempting the question.
Okay. Well, Dr. Manav, what we understood from your journey is, because, as I said, you've already scored a great rank in the last NEET also, and then again in the INI, and then again in this INI, you got the rank of 13. So you were pretty consistent in getting these top ranks. So I would want that you take your time and like just think about the people who are going to give the exam in 3 months, and just kind of motivate them, tell them it is, if it is possible, because people are genuinely looking for someone to give them a advice, like not like just for the sake of interviews only, someone to tell them कि यार हाँ, it is possible, हो सकता है, this is all we need to do. Not the kind of thing that you need to revise subject 20 times, you have to give 100 GTs, nothing like that. But if it is possible, what like realistic rank they can get, and how much time they need to dedicate, and what should be their revision strategy, what they need to focus on. I want to take your time and just kind of give it a little insight to this.
Definitely, sir. So, to all the participants giving NEET 2024, the exam is out of March.
Yeah.
So, I would say you have about 3.5 months to go. So, what I had learned in the last exams that most of the questions are from the topics. So, you don't need to run around the bush. Don't need to go for 10 resources at once. You have to target, say, 180 or 190 questions. 10 questions are going to be out of reach. Just accept the fact and go on. Make sure that you revise whatever you have read in the past few years. Don't go for anything new, as I said, and keep on revising it again and again. Do the images properly. Do the previous year's questions very nice. One thing, as far as grant tests are concerned, as I said, grant tests should be taken in a way that you're learning something out of it. Don't just come out depressed that I have got, say, a maybe rank of 10,000, 20,000 KGT mein. Don't really worry. Right now, your focus should be to attempt 190 questions and come properly.
Yeah.
It is not the GT rank that is going to matter. Your consistent efforts, persistently going forward. You should see an improvement in the rank every time. That is how I take it. Whenever you read a subject, you should be confident about that subject from the next GT onwards. So if you have 3 months, divide your timetable in such a way that you are solving as well as reading focus more on the previous topics and the previous year's questions, and like step by step. Don't just get carried away by any ranks. Keep focusing. Anybody can do it. NEET is going to be a straightforward exam. You have to have the courage in yourself, faith in yourself. You can do it. Even if you have not read, even if you're not getting a great rank, in the next 3 months, if you do your previous questions very nicely in the topics very nicely, stick to the specific set of notes that you have read, remain calm on the day of the exam. That is very important. Don't think about the rank. Don't think about how many questions are going wrong. You're not able to attempt. Just remain calm, and it is going to happen. I'm telling you, 150, 160 correct is not going to be difficult.
Yeah.
Anybody can get 160 questions correct. That is going to be the trick.
Yeah.
You
Dr.
have
Manav,
to.
you mentioned about PYQ. I wanted to know that how many years should go into the PYQ. When you say PYQ, is the PYQ of only the NEET exam, or is it INICET also, or do you consider even FMG PYQs as well?
So yeah, so the board that prepares the exam is NBE. So I think the best is definitely NEET previous year's questions, and more importantly, the past 5 years. Firstly, and definitely INICET. I would prefer less to FMG. FMG is often set by the people of NBE.
Yeah.
So yes, FMG can also be good, especially the past 3 years. INICET only and only if you have time, because the variety of question is totally different.
Yeah.
The
It
type
is.
of question is going to be different. So I would prefer FMG and NEET passes questions more than INICET, honestly.
Okay. Well, that's a great insight, Dr. Manav. Well, I'm sure that there must be people in your life who would have helped you to reach this point right now, parents, friends, and your colleagues, teachers, and everyone. Well, why don't you take the stage and just thank whomever you want to? Please go ahead.
Yes. So yes, I'm really thankful to my mom, to my dad, and my brother, my best friend Manaswi, and family, all my relatives, all my friends, Soumya, Soumitra, Dheeraj. They have been great, and I'm really thankful to all of them. And it couldn't have been possible without all of you all. Thank you very much.
Yeah. Wonderful, Dr. Manav. Well, Dr. Manav, last two questions. So, number one, that what is the stream you're planning to take? What do you want to do your PG in?
I'm planning to pursue radiology. First
Oh,
preference will be AIMS Delhi, and second preference will be from PGI Chandigarh.
wonderful, wonderful. And the second and more important question, who's going to win the World Cup this time?
It's probably India. It definitely looks like India.
Great, Manav. Great talking to you, man. You're a full of life, and well, what you've achieved in these last it is incredible, and I'm sure people will take inspiration. Keep inspiring people. Have a great. Thank you so much.
Thank you very much. A pleasure talking to you, sir. Thank you so much.